Good afternoon, everyone. My name is Parveen Shaikh. I'm a medical student at Batumi Shota Rusudan State University in Georgia. And today, me and my colleagues are going to present a small review article on MTHFR gene polymorphism and an association with the disorders. So, what is MTHFR gene? MTHFR is an enzyme which is methylene tetrahydrofolate reductase enzyme, and it is a very important enzyme and a cofactor for methylation processes of various DNA and RNA. And this enzyme, its gene, MTHFR gene, is located on chromosome 1 on the P arm, and it is very crucial for controlling folate as well as homocysteine metabolisms. There are about 20 genetic mutations which are identified to this enzyme, but only two of them are very extensively studied in various literatures. One of them is C677T, and other one is A1298C. The later one is much milder and it is not of that of clinical significance. Although both of them are studied, we extensively study C677T gene, and also it has a higher clinical significance in metabolism of homocysteine as well as folate. So, what is the function of MTHFR gene? This enzyme is responsible for various folate and methionine metabolism as well as for regulating the levels of homocysteine in our body. Now, whenever there is a mutation, it impacts the enzyme activity of that gene. So, similarly, C677T gene mutation has been linked to decrease in the enzyme activity. When it was seen when there is a heterozygote CT genotype, the decrease in the level of the activity is much less, and 70% of the enzyme activity is preserved. While in the case of homozygous TT genotype, the decrease in the levels of the enzyme activity is much higher, and only 30% of the enzyme activity is preserved. This this enzyme is responsible for the regulation of homocysteine levels. So, thus, whenever there is a decrease in the levels of this enzyme, the homocysteine levels have been shown to be increased. A much higher levels of homocysteine was seen in the homozygous. When this homocysteine levels have been seen to increase, it is known as hyperhomocysteinemia. And this hyperhomocysteinemia is linked to accelerate the atherosclerosis in our body. So it has been linked to increasing the risk in an individual of coronary artery disease. Similarly, increased coronary artery levels, increased levels of the incidence of coronary heart disease was seen in homozygous. Since the enzyme activity is much lower, there's much higher levels of homocysteine in the body. What is the focus of our literature review? So our focus of literature review was to explore the relationship between this C677T genotype mutation as a single nucleotide polymorphism with various disorders, not only cardiovascular diseases, but also to other, for example, various type of cancers, diabetes mellitus, even some of the venous thromboembolism, pregnancy issues, COVID-19 issues. So we explore in our literature review various relationship and association with this genotype. Moreover, in our review, we had focused on various variation which is present from population to population studies. So ethnic variation has also been discussed and studied in our review. As you can see that hyperhomocysteinemia has been linked to various disease processes, mostly towards the cardiac as well as coronary artery diseases from myocardial infarction to hypertension, and which has also been seen to have higher susceptibility varying from population studies. We start focusing our association with cardiovascular diseases. So various population has been studied from starting from Chinese population. It has been noted that the CT and TT genotype has higher prevalence of coronary artery diseases compared to the C allele. So, a strong association was seen in MTHFR gene polymorphism of CT and TT genotypes, while not much was seen for the C allele. And higher Clinical significance was also seen. The p-values were much less than 0.05, suggesting that higher strong association was seen for this gene polymorphism in the population studies of China. And similarly was seen for the Japanese population. The specific T allele was linked to increased intima media thickness in the case of T allele. Homozygous levels were also associated with increased carotid stenosis risk. Moving along, one of the study population which is of a keen interest to us was done in Nagervadze, Batumi city, which focused association to arterial thrombosis risk, and it has found that increased incidence was seen in cases compared to the controls. The p-value was much less than 0.05, and it has showed that whether it is carotid artery or thrombosis risk, it was much higher in patients with the MTHFR polymorphism than in controls. Moving on to the Brazilian study, it was found out that in adolescent population, the cardiovascular risk was also increased in the adolescents which had this gene polymorphism, and it was seen that hyperhomocystinemia was also linked to altering the lipid levels, mainly the LDL, lower density lipoprotein, in the CT genotype, which is the heterozygote genotype. As I've already discussed previously, that population to population study has been shown variations, and there are major inconsistencies. So some population may show higher levels of incidence, other population may fail to show such association. So the reason for this inconsistency could be various confounding variables could exist. Overall, we can note that MTHFR C677T gene polymorphism could act as an independent risk factor for the carotid artery stenosis, or it could be indirectly related to atherosclerosis, as mentioned previously, due to hyperhomocystinemia in the body. Moving along to association with the diabetes mellitus and its complication. An interesting study was done, and it showed that both Japanese population and Egyptian population showed that the homozygous levels of TT homozygous had an increased incidence of diabetic retinopathy, which is a complication of diabetes mellitus. So, in clinically significant levels were seen of TT homozygous with diabetic retinopathy. Similarly, for the Egyptian population studies, it was seen for diabetic retinopathy, also for polyneuropathy, and even in the case of patients with diabetes mellitus having ischemic heart diseases. All had similar genetic polymorphism of homozygous TT genotype. In the case of meta-analysis, which was done in Caucasian population, interesting find was that it was not related to increased risk in retinopathy, and it showed that in this case, the increased risk was seen for diabetic nephropathy in Caucasian population. So although same genetic mutation was seen in different population, different complication could result in increased susceptibility to different complications. um, Interestingly, when a meta-analysis was done for the Chinese population, it showed that it was associated with increased diabetic nephropathy, but not to the disease incidence of type 2 diabetes mellitus. That means this mutation had no link with the incidence of type 2 diabetes mellitus, but showed increased in the susceptibility to diabetic nephropathy, which is the complication of diabetes. So it was an interesting study which showed that although it may not cause diabetes mellitus, but if in those susceptible patients in which diabetic patient, it has shown to increase the risk of nephropathy. Continuing with the association with cancers, similar studies have shown, it has highlighted that complex relationship has been found, that although in some of the studies it has shown increased cancer risk, others have shown that even in the same polymorphism, different allele showed different alleles show different incidence, as well as in some population there may be an increased cancer risk, in other population there might not be an increased cancer risk. So let's explore together. In the case of breast cancer studies, it was shown that higher significance was seen in the heterozygote genotype, which is CT, which is also one of the types we are studying today. And also T allele was significant in the case of the breast cancer in Indian population, in Indian women, while in the case of the Mali population, no such statistical correlation was found, hence proving population to population variation does exist for the genotypical studies. Moving along for the esophageal cases, similar alterations were found, similar increased risk was found. In the case of leukemia lymphoma, some of the studies did show that there was strongly related, although, for example, in the case of chronic lymphocytic leukemia, a study done showed no significant contribution from either of the genotype to the development of, chronic lymphocytic leukemia. Moving along, in the case of gastric and prostate cancer, a very interesting ethnic differences was noted. For example, in the gastric cancer, a meta-analysis showed that when data from 28 studies was done, it showed strong relation in the case of Asians, while not so much in the Caucasians. Thus, noting that ethnic differences could exist for the same genotype polymorphisms. Similarly, in the case of prostate cancer, again meta-analysis showed that the CT variations was much higher for the East Asians related to the other population, and also other CC genotype, CC allele was linked to lower risk in Europeans, hence proving advantage for Europeans, but had higher in Asians, higher risk of incidence of prostate cancer in Asian population for the CC homozygous genetic polymorphism. Moving along to other various disease association could be seen. For example, in the case of venous thromboembolism, it showed that there was an increased susceptibility in Asians and again not in Caucasian. And for other genotype, for example, in the case of A1298C, there was no significant association noted. Similarly, for pulmonary hypertension, it was noted in that the severity there was correlated with increased severity of the pulmonary hypertension patient who had such mutations in MTHFR polymorphisms. Moving along to the gynecological complication, it was seen that in one of the study that in pregnant women presenting with MTHFR polymorphism, there was increased risk for adverse pregnancy outcomes. Specifically for the study for our significantly for C677T polymorphism, and such relationship found can also help us to navigate whether adverse pregnancy outcome is related to such genotypic variations. Moving along to COVID-19. So in the case of the COVID-19, both direct and indirect association for this genetic variation was seen. For example, a strong association was seen in the case of Latino population, both in case of the incidence of COVID-19 and related to COVID-19 deaths. The main contributing factor could be directly, but in another study, it was shown that it could indirectly contribute to the COVID-19 mortality to hypercoagulability. For example, the hyperhomocystinemia could lead to increased thrombosis risk, and which could lead to hypercoagulability in the case of COVID-19 patients, which would impair their recovery and also impair their lung improvements, which can cause their deaths and also thrombosis in the case of COVID-19 patient, thus influencing the morbidity in the case of the COVID-19 patients. Moving along, one of the interesting studies was found that in the case of COVID-19 in young females, there was a cases of spontaneous thromboembolic diseases, which was linked to the genetic mutation in the said gene. Despite having normal homocysteine levels, it was not even due to the increased homocysteine levels. So far, we have discussed that increased homocysteine levels was associated with increased thrombosis risk, but here it was proven that young females which had only genetic mutations did not influence much of the homocysteine levels, had thromboembolic implications. So it emphasizes that there could be other factors playing into this. Maybe some environmental and genetic confounding variables could also play into this. Thus, we can conclude that Such influences, the influence of MTHFR gene polymorphism is multifaceted. It could relate to various implications in various medical condition, could be from pregnancy outcomes to COVID-19 severity, and understanding these genetic association very necessary. It could enhance in the case of clinical settings about the risk assessment, could improve our treatment strategies, and also some preventing measures which can we take from population to population studies and even for individual genetic profiles. So in conclusion, we should explore long-term impacts, for example in the case of cardiovascular health, where long-term impacts could be very important to be discussed. We should also emphasize in population which has shown to have higher susceptibility to have genetic counseling and education. Moving along, such population to population studies have various impact on such gene polymorphism, and a more comprehensive studies could be done to improve in the treatment strategies, to also improve in the case of other personalized risk assessment, which can be done in clinical setting, for example, in the pregnant women, for example, in COVID-19, and most particularly in cardiovascular health risk assessment. So we should further investigate the role of MTHFR polymorphism and should have more comprehensive studies done. Thank you so much for listening to me. Hope you find it very helpful, and thank you.